Thank you all for coming to the Drug and Alcohol Research and Innovation Active Learning Network, or DARIA. I'm Chris Monty, who I usually chair this meeting. I was away last week, so thank you to Krista for stepping into my shoes. We are joined today by somebody who's already presented once this year for us, but was very popular, and we wanted to have him back, and that is Quentin, who last time talked at length about the issue of trauma in the drug and alcohol sphere. So as many of you know, David is a clinical psychologist who's worked with the Youth Drug and Alcohol Service of the Illawarra Drug and Alcohol Service for the past 18 years, which has involved working with a range of people living in many difficult situations with varying levels of motivation for change. He has seen people change and see people not change. And I think we can all relate to that. He believes the voluntary nature of drug and alcohol services provides a backdrop that respects people's autonomy and control of their lives. He has never recklessly invaded a neighbouring country, never taken classified documents to his home or country club, and was nowhere near Scotland last Thursday. Okay, that's your word against everybody else's there, David. And today, I believe he's going to be talking about the incredibly relevant topic of motivational interviewing. So, David, I'll hand it over to you.
Thank you very much, and thanks for having me along again. And yeah, I maintain my innocence on all charges. I'm just going to start sharing my screen, and that way we can get going. So can people see the slides up there now?
That's working very well, David.
Good, great. So today I'll be talking about motivational interviewing and stages of change, or alternatively, look what they are and why you should care about them. And with the alternate title of Let's Have a Chat About Gyms and Scruffy Detectives. Before I start off, I should say that the room that I'm doing this webinar in today is right next door to our needle and syringe program. So if you hear any yelling in the background, it's probably just some of our clients struggling with their inside voices, as they sometimes do. And I apologize in advance if that is distracting at any point. I'd like to acknowledge the traditional owners of the land we're meeting on today. I'm speaking to you from the land of the Wadi people of the Darrell Nation. Sovereignty over this land is never ceded, and it always will be Aboriginal land. So I'd like to pay my respects to elders past, present and emerging, especially any of the who are here with us today. So thank you for being here. So just briefly to sort of explain who the hell I am and why I'm here talking with you about this. Yeah, I work with the Youth Drug and Alcohol team in the Illawarra Drug and Alcohol Service. So that's counselling with 12 to 24-year-olds. And I've been there, that should be 18 years. So a lot of my clients weren't born when I started working in the service, which is a weird thought to have when you actually start to think about how long you've been plugging away at something. Many of the young people I see are not coming along because they want to. A lot of the people that come along to a youth drug and alcohol service are attending under some level of duress. So whether that's legal, the legal system forcing them to come along, or their parents or schools or anything else. So we do see a lot of people who are what we might label as coerced clients, but I don't know that that's a particularly useful name, because if we start to label some clients as coerced clients, it implies that there's another set of clients who aren't coerced, and I'm not sure that those people exist. Everyone that we see is coerced at some level by something, whether that's the legal consequences, the consequences on the relationship or the health, whether they've started to experience pain emotionally or physically, whether it's getting in the way of their mobility, say if they've lost their license. Everybody's coming along with something pushing them. Nobody turns up to a health service of any kind because everything is going swimmingly on that day. They're there because something's gone wrong, and that something that's gone wrong is pushing them to get it fixed. And we all would like all those things to go away. And it'd be lovely if those things would go away without us having to change anything. And that's exactly the mindset that a lot of people arrive at counselling with. Wouldn't it be great if there were a magic wand that can make this all go away without me having to do anything differently? I don't own that magic wand. I don't know if any of you guys do, but certainly it's usually involves a bit of hard work, and it involves people having to find their own motivation to do it. I can't be there with someone 24 hours a day, neither can you, and that's why motivational interviewing is really useful. So what I'm going to be talking about today is some of the principles of motivational interviewing and how it can be used with our clients to help them step towards change. Talking about those principles, though, can be really, really boring. So I'm going to try not to actually spend too much time focusing on the principles, and instead actually talk about some of the practical applications of it, ways that you can kind of find in your own life to develop the sort of mindset that fits well with motivational interviewing, so it starts to happen a bit more effortlessly. And so instead of focusing on too much academic stuff, instead I'm going to be talking about what's happening with my gym membership and also with the TV show Columbo, which hopefully there's some people in the audience today who can actually remember the TV show Columbo. But you'll probably, when we get there, it'll probably tweak your memory. Unfortunately, though, we can't skip over the dry stuff entirely. Otherwise, people will say, David, you're not doing your job properly. What sort of a webinar was that? So here's the dry stuff that I'm actually not going to spend a lot of time talking about today. Motivational interviewing is a counselling intervention developed by Miller and Rolnick. It's quite a directive intervention, but also client-centered. It's designed to draw out and clarify the reasons for the change that a person already has, so that that person can then make the decision around the change themselves. It's less a bunch of techniques so much as it is an approach to conversation with clients and a mindset to come into those conversations with. Especially in the more recent editions of their work, motivational interviewing is about eliciting change talk, with the assumption being, and it's an assumption that's backed up by the research, that the more a client talks about change, the more likely they are to do that change. It's not the case that there's people just sort of talk about change and never enact it. If people are encouraged to and talk about change, they eventually are more likely to end up doing it. What that means is that if we can encourage them to talk about change, that we probably should. So motivational interviewing has 4 main guiding principles, and we'll go through each of these in a little bit of detail just to explain them for anyone who hasn't come across it, although I'm sure most of you probably have, and this is just a refresher. So the first is to express empathy, also to support self-efficacy, to roll with resistance, and develop discrepancy. So if we start with expressing empathy, we all know what empathy is and how to express it. Empathy is not sympathy, it's not pity, it's not claiming that we understand everything about somebody's situation. What it is being prepared to listen closely to what they say so that we can form in our minds an idea of what it's like to experience the world as them. When it comes to motivational interviewing, that gets quite complex at times, because what we're expressing empathy for often is a lot of things that actually don't go particularly well together, that contradict each other. We might be expressing empathy into how someone's drug and alcohol use is related to their mental health problems, whether they're using to self-medicate or whether they're finding that their mental health problems are worsened by their drug and alcohol use. We might also, and this can be uncomfortable for some people, find that we're actually empathizing with the idea that some people actually enjoy their drugs and that there's good things still happening for them in association with their drug use. So there's good things about them. We might be empathizing and understanding how it's affecting their relationships, how it ties up with other things like self-harm or other addictive behaviors. And we might also, even when we find ourselves empathizing with people who are saying that drugs are bad, that thought and that understanding of drugs is not especially one-dimensional or simple. That even when the people are willing to acknowledge that drugs are bad, it's still tempered by the fact that there's things about them that they enjoy about drugs. That's why people use drugs, because by and large, they're enjoyable, at least when people start using them. It's also about supporting self-efficacy. And I think that this is, exemplified by the little engine that could, that puff, puff, chug, chug, went the little blue engine. I think I can, I think I can. Up, 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 faster and faster. The little engine climbed until at last they reached the top of the mountain. The little engine that could only could do it because they thought that they could. They could only do it because they believed that they could. That didn't guarantee that they could. They also needed to have the skills and the strength and the power to do it. But had they believed that they couldn't, it would have guaranteed that they wouldn't. We've all, I'm sure, had clients who come along and they say, I would really love to give up smoking cigarettes, say, but I don't think I would be able to do it. And they are the people that generally don't even try, that they don't make attempts to quit, or if they do, they're pretty half-assed because they don't actually believe fundamentally that they can. So there's a role for counsellors to be able to support people's belief in themselves that these things are achievable, that they're difficult, but that they actually can do them. Rolling with resistance is basically about trying our hardest to avoid arguing, which is harder than it seems, because often people will come out with statements which are, quite demonstrably and obviously wrong, things that we know are not the case, and we want to chime in to correct them. That's a natural, normal human instinct. But what that can end up with us getting caught in is a situation where we're arguing to be right, rather than listening to someone to see if we can understand where they're coming from. The danger of that too is that if we start to occupy the position in the room where we're arguing for why they should change, it really leaves no position for the client other than for them to be arguing against that. They have to take up the position of why they shouldn't change. If we're arguing one point, they have to argue the other. And we can set up this dynamic where all that the person we're talking to hears coming out of their own mouth are arguments why they shouldn't change. And any argument we hear coming out of our own mouth is going to be more convincing than one we hear coming out of the person across the room's mouth. You could have all of the correct facts at your disposal and you could express them as eloquently as you like and be as persuasive. And it's not going to match the level of believability that they will find the statements coming out of their own mouth have. That's because of all of that basic psychological stuff that we know about cognitive dissonance and the idea that, oh, well, if I've heard myself saying it, I must believe this. And if I believe this, it must be true. And that's part of the reason why we're trying to elicit that change talk. The more we can get people to be talking about change, the more they're going to find those arguments believable. And that's where change is likely to happen. The last principle is a little bit more tricky. It's about developing discrepancy. And I think it's important to know what we mean by that. It's not about confronting people with reality. It's not about saying, oh, yes, you think that this drug use is not causing you any harm, but in reality it is. And here, let me show you all the ways that it is. It's developing discrepancy between their own thoughts. It's working on their own ambivalence, that there's parts of them that want to keep using and parts of them that want to change, and highlighting those discrepancies between those various parts of themselves. That's why I think that this image goes along really well with it, because if you look just at the left-hand side, it's an object that has 3 tines and it makes perfect sense. And if you look just at the right-hand side, it's an object that has only 2 tines and it makes perfect sense. If we're only looking at either of those sides, then the object makes sense. We only start to see that the object doesn't make any sense when we can look at them both together and see that one end of that has 3 tines and the other has 2, and that can't work. And that's what we're trying to do when we develop discrepancy with our clients, to get them to see, you've made this statement and you've said this about your position around drugs. But I've also heard you say that there's this other thing, and these two things don't fit together. Help me to understand how they fit together. And as they're talking about that and trying to put those discrepant facts together for themselves, it does lead to some change in the way that they think about things. But the thing is, it's not magic. And it doesn't always lead to people changing. There's a number of reasons for that. One is that sometimes this is a process that guides people to look at the various parts of their ambivalence and the pros and cons of their drug use and the costs and benefits of change, and reach a very rational decision that change isn't worth it, that things aren't bad enough to warrant the effort that would go into changing this. And an example of this, I think, that many of us can identify with in our day-to-day life, one that I certainly can, is that every morning, the first thing that I do when I get out of bed is I put the kettle on, because I'm going to make myself a cup of coffee, because I need the caffeine to get me going for the day. If I don't have it, I'm a bit of a mess and I'm not very good for much. My body is very much dependent at a physiological level on caffeine. I know this, and I know that it has some downsides, but I also don't see that those downsides are enough to sort of push me to make the change. It's not costing me a hell of a lot. The supply of caffeine is fairly regular, so I don't need to worry about going into withdrawals if I don't want to. It's not having huge immediate effects on my health. I've reached a rational decision when I look at all of the pros and cons. It's just not worth changing, even though I am dependent on it. Other people might reach a different decision, but that's the rational decision I've reached. And if we're not prepared for people to reach that decision to say, thanks, but no thanks, I'm not going to change, we actually can't do motivational interviewing properly. Because if we're not prepared for that, we can't actually listen empathically properly. We'll be listening with an agenda. We can't avoid argumentation properly, because we are at heart trying to push them towards a certain outcome. And that runs counter to what motivational interviewing is doing, which is guiding them to look at their thoughts, their feelings, and the ambivalence in those around their drug use. And the reason for that is because motivational interviewing and the problems that we're doing motivational interviewing around happen on a background. And this is my, reasonably dodgy representation of the stages of change that Prochaska and De Clemente first sort of articulated back in 1983. Originally, it was in relation to smokers and how people who were giving up cigarette smoking, what that process was like. How did they come to give up? It's basically just describing the process of change that they saw. Since then, it's been looked at in relation to cigarette smokers of different backgrounds, to people with drinking problems, all sorts of other drug problems, to lifestyle changes for people with diabetes, to changes in exercise behavior, the whole gamut, anything that involves human beings trying to produce change in their behavior seems to follow these stages. They're not, a rigid cycle. People do kind of go back and forth between different stages, but generally all of these stages are there. Most of us start any change process in a pre-contemplation stage. So pre-contemplation is when we're not even really thinking about change. We're quite happy with things the way that they are. For a drug user, that's somebody who is quite happy to be a drug user. This is what they want to do and they're enjoying it. Sometimes, if the costs of it start to mount up, people can find that they move into a contemplation stage. And that's where they're starting to think, maybe I might want to change this sometime. Maybe not now, but maybe down the track. There's some things that I'm not happy with about this. And that's a time when people are thinking both yes and no to change at the same time, or they're flipping between yes and no, but they're not committed to either side of that. If those discrepancies add up and they start to think, yeah, actually, it is worth doing some change, they might move to a planning stage. And even at that stage, they're still not changing, but they're thinking about what they'll need to do if they were going to change. What do I need to get organised so I can change these things that I want to be different? From there, they may move to an action stage. That's where they actually make the change. This is a really exciting stage for most people, and a really great stage, because everyone's cheering you on and they're going, wow, this is a great change that you've made. We're so proud of you. And it's a really good place to be. But from there, they have to move to maintenance. And that's where we've made a change, but now we've got to do the hard work of actually keeping that change going. And that's not always a given. From there, we can, if we're really lucky, we exit this cycle entirely, and we move on to having the new behavior as just our new normal. But also, part of this change sometimes involves lapse or relapse. So people might go back to the old ways of being, briefly or for a longer time. But from there, and that's why it's not the end of the world, they can learn from that and actually go through this cycle again. And sometimes they might even skip stages the second time around. They might go straight from a lapse straight to planning. Or they might have already done the planning and they go straight from a lapse back to action. But they can circle around this. And each time, it's kind of an upward spiral that they get slightly better at making that change happen. Basically, they've ironed out the kinks. The research around smoking, I think, now says there's anywhere between 16 and 32 times that people cycle through this before they successfully give up cigarette smoking. That's on average. So some people get it first time, some people take a lot more. But and the positive bit about it is that your chances of success on each subsequent attempt are exactly the same as they were on the one before. So it's not like that, oh, I've tried this 4 or 5 times and it's not working, so I should give up at it. I'm no good at quitting. But there's every chance that the next time will be the one that will do it. But it also brings us to some really interesting questions about what we mean by change, because that kind of defines a process which is pretty complex in its own way. But it seems, okay, yep, there's stages there, I can get my head around that. But we rarely have people who come along to our services who are only looking to change one thing in their life. A lot of the time, and this is a common thing, people will say, yeah, I want to stop smoking crystal meth, but I'm quite happy with how much pot I'm smoking and I don't want to make any change to that. Or I want to go in and do this detox, but the idea of giving up cigarette smoking while I'm in there is really challenging, because they're in different stages of change for different substances that they're using. For one, they might be in a planning or an action stage, whereas the other, they're still pre-contemplative. Also, there's lots of times when people might come along and the change that they're actually thinking of might be different from what we were thinking. We might be thinking of, okay, this person wants to stop smoking pot, but they're thinking they want to cut down how much they're smoking. They might be in a perfectly, planning stage or an action stage for cutting down, but they're still very much in a pre-contemplative stage for quitting. So clarifying all of that introduces extra dimensions to those stages of change, which makes it quite tricky. And I said that we would talk about my gym membership. So, probably we should do that. And if we look at that in context of these stages of change, I think it can clarify things. And if, as I'm going through this, you think about other things in your life that this same process might apply to, it can help to clarify it. So whether that's changing your diet, going to the gym, in the case, if it's similar to this, or whatever the change is that you're making, giving up smoke, whatever. So this is me, or it was me when I drew this, but now I have to change the colour of the beard quite significantly. if I'm truthful about it, I'm quite unfit. I also don't enjoy exercise a whole lot. I think it's quite hard work, and it's strange to me that people say that they enjoy it. I don't know where that comes from. What I do enjoy is cake. I like cake. I like chocolate. I like biscuits. I like eating, and I get a lot of joy out of that. Also, when I get home from work, often I'm really tired. I walk in and the lounge looks really attractive. That's where I want to go. I want to sit down and just not do anything. At the same time, though, I would like to be a bit fitter. There's lots of times where, you know, it might dawn on me that, yeah, I could be doing this differently. But I also get a bit embarrassed at the gym. Often I don't know what I'm doing on the machines there, or what I should be doing. What exercises should I be doing? How do I do them? And also, like everyone else, you know, I don't look my best when I'm exercising. I sweat in weird places and my body makes funny noises. There have been times where I've been completely pre-contemplative. I've been quite happy to sit on the lounge and eat chips and watch telly. The lounge was really comfortable. The chips tasted really good, and the telly wasn't all that great, but it wasn't demanding much of me either. I was in a pre-contemplative stage. There have been times, though, like I was saying before, where I've started to go into that contemplative stage where I'm thinking, shit, walking up these stairs is harder than I think it should be. Or it'd be great to be able to keep up with the kids a bit more. But still, yeah, I'm not quite convinced on it. I'm not sold. I'll be yes and no, but I'll be in that contemplation stage, and you know, you can stay there for long periods of time. There have been times though where I've gone into planning stages and I thought, no, I've got to do something about this. I've made up my mind. I've got to do something. I have to, you know, get some new gym gear and check out the prices of different gyms and sign up to one that I'm going to get the best value out of. And I've done that. And I've even gone along to the gym, and, you know, and that's great. Everyone just sort of goes, oh, well done, David. This is brilliant. You know, we're so happy for you. It's great to see you doing something about this. And yep, it feels good. And I go along, and that kind of makes it bearable to, you know, do the hard work of exercise while I'm there. But then I reach this maintenance stage where I've got to keep it up, and it's 6 weeks down the track. All of the cheer squad has disappeared. And now I'm just going to the gym on a Wednesday night in the rain going, what the hell am I doing? Why am I even bothering to leave the house now? I should be, you know, somewhere comfortable. This is not worth it. And that can be a struggle. It's quite a lonely place that's hard work to keep things going. From there, I might exit the whole cycle and just go on to a new life. And it's like, oh, okay. As it turns out, I've sorted out all of those struggles and now going to the gym regularly is a normal part of my life. Or I can end up lapsing and relapsing into old behaviors. It's not too much of a surprise, I'm sure, that's basically describes where I am now. That I've been to the gym, I've done that, and then it got unenjoyable. I stopped doing it, and that's where I'm at. I can go around the whole cycle again, and I'm sure I will at some point, but that's where I am now. You may be thinking, what the hell does this have to do with anything at work? So I'll bring it back to that. And I think it's important to understand these processes as they happen to us, because it actually makes us more understanding of what's happening with the people that we see. It helps us to kind of empathize a lot more accurately when we see that these processes that we're watching them do, as frustrating as they can be to an observer, are normal, and we go through them as well. So this is Jono. Jono smokes quite a lot of pot. He thinks being sober is boring. He enjoys his drugs quite a lot. Thinks they're pretty heckin' good. Most of his friends use. So a lot of his social life is tied up with smoking pot. At the same time, though, he'd like to get back to school. And he's a bit confused, though, because he doesn't really know what sober people do. If you're not smoking pot with your mates after school, what are you doing? Don't know. There has been times, and you might encounter Jono when he's in a pre-contemplative stage. He's quite happy to play Xbox and smoke pot, and that's his life, and that's all he wants from life, and he would rather you leave him alone. Thank you very much. Though you might also encounter him when he's in a contemplative stage. So in this stage, he might be thinking more about, oh yeah, this is getting a bit boring. You know, I've played all of the, you know, Xbox games that I can, and I haven't had sun on me for like weeks, and I'm starting to feel a bit lousy about myself. Maybe I need to make some change, but also still not entirely convinced. We might be lucky enough to meet Jono in a planning stage where he's basically sitting down going, I want to make this change. Help me understand what are the steps that I will need to do to make that happen. We might see him in the action stage where he turns up saying, yep, I had my last smoke yesterday and I smashed my bong and everything's been thrown away. And I need you to support me to keep this change happening. Or we might see him in a maintenance stage down the track where he's sort of going, this could go either way. I'm kind of not smoking still at the moment, but I'm noticing that all my friends still are. And this is, you know, not helping my social life at all. And it's really frustrating. I don't know what to do. Our aim is hopefully, usually, well, the aim of our services at least, is to help people exit to that new life where that becomes his normal way of being. But he might also lapse. And again, he will go around that circle again. So how does motivational interviewing fit into this? Well, we encounter people at various stages in this journey, and motivational interviewing fits well with some parts of it, but not with others. So it's only sometimes useful. It's really useful if we encounter someone who's in a contemplation stage, because they have that ambivalence. There's lots there to work with. We can actually get in there and explore what are the pros and cons of their using, what are the costs and the benefits of change, and help them to, you know, put all of those factors on the table and see whether they want to change. Move them along potentially these stages of change. It's also helpful, very helpful in the maintenance stage when people are finding that this has gotten really hard work and I'm finding it a bit exhausting. Why the hell am I doing this? In this case, motivational interviewing is a really good way to reorient people to the reasons for their change. It's very much like that Viktor Frankl quote that when somebody has a why, they can endure any how. So this is part of that. Motivational interviewing can reorient people to the why that they're doing something. It's also useful if someone's had a lapse or a relapse, in reorienting them to, hang on, you've had this lapse, you're back smoking, but weren't you telling me a few weeks ago that these were some of the reasons why you wanted to stop? Do these still apply? What are your thoughts on this now? Where it's not useful really is in the planning stage. If somebody has already decided that they want to make some change and they're planning for that, that's what they want help with. Same as if they're in the action stage, they want support with the action. It can get very frustrating if we spend a lot of time when someone comes saying, I really want to change. How can you help me? Give me some strategies to help me change. And we spend a lot of time going back to their reasons why they would want to change, because that's not what they're here for. It's like, no, David, I need you to help me with this thing that's happening right here and now. So motivational interviewing is not very useful there. You know, there might be elements of it that come up from time to time, but we wouldn't spend a lot of our sessions talking about that. It's also not very useful if someone is pre-contemplative. If they have no ambivalence, they're completely happy with their drug use, then motivational interviewing is not going to do much. And you can understand why, because, you know, when you elicit all of the reasons for change versus the costs for change and the pros and cons of their current behavior, they're really heavily invested in their current behavior. They're not going to see the downsides of it yet, and maybe the downsides aren't there. Maybe it's like my coffee, that they've made in their mind a rational decision to continue with what they're doing. So that's a time where if somebody is completely pre-contemplative, or in some cases actively non-contemplative, you will have, and I'm sure you've all met these people, those people that sit down and they're just the completely committed smoker. It's entirely part of their identity. That's what they do. They live and breathe it day in, day out. You know, it's like you're sitting opposite Willie Nelson. There's no point in trying to talk him around out of his current behavior. That's just him. They're not going to change at the moment in response to motivational interviewing. The most that you can hope for is that it might move them a little bit into a contemplation stage, but it's certainly not going to have them, you know, leaving your office going, thanks so much for that, David, you've changed my life with that discussion. We're better off there focusing on, you know, some harm minimization advice and actually making the experience as pleasant as possible, so that if things do change for them down the track and they are further along that stage of change, they'll be willing to come back. Which brings me to the other part. What about Columbo? I mentioned him before. Columbo was a detective show that was on, you know, in its original running between 1971 and 1978. This is Peter Falk. He played Columbo for the entire run of it. And he played Columbo as this detective who was described in some reviews, I really like this, as shrewd but inelegant. I like that description because shrewd I aspire to, but inelegant I'm already there. And I think so I'm halfway there. I can probably get the rest of the way. Columbo was a bit of a weird television show at the time because it was a detective show that wasn't a whodunit. The audience actually knew who did it. The very first scene of the show every time was the person committing the crime. So the audience was in on it. They knew exactly who did it. What the show was about was the process of how Columbo went about getting information out of people so that he could work out who did it, and also that he could get the people involved in it to basically confess to it without realizing that they were. So, and some of the great things about Columbo is that he's a bit of a mess. Every single episode, he wore the same, you know, crumpled up raincoat. He was always had a cigar with him, which most of the time wasn't lit, and he just looked generally messy. Hand in hand with that, he didn't present himself as the expert. He didn't come in saying, I already know who's done this, and I'm going to demonstrate how smart I am in solving it, which places him in contrast to people like Sherlock Holmes, or Poirot, who might assemble everyone into a room and talk them through how he knew and worked out who the murderer was. Columbo didn't present himself like that. He just talked until people basically confessed. He has patience. He was willing to follow that process through so that he didn't have to rush people and didn't get frustrated with people, as it took time for him to move them along to that. He avoided argumentation. He very rarely ever got into disagreements with the people that he was dealing with. In fact, he was polite, you know, all the time. And he had the style which acknowledged the person's worldview and actually said, oh, I can see what you mean by that, because from your point of view, this is how it would look, even when he knew that was incorrect, even when the audience knew it was incorrect. But he was willing to play along with what the person was actually coming out with, because he realized that for that person, that was reality as they understood it. Why are we talking about Columbo? Because he's actually a good model for the MI mindset. If you remember when I was talking about those principles, that motivational interviewing is not really a set of techniques, and it shouldn't be. If it's being applied as a set of techniques, then you're really going to find it hard to do, you know, because you're kind of pulling things out of nowhere. that make it sound and make it feel to the person doing it that you'd planned this conversation out beforehand and they weren't the one who was driving it. Yeah, so going with the flow in the way that he does, because what he does is he listens for discrepancies and he asks questions to elicit that discrepancy. He lets the stories unravel gently by presenting those discrepancies back to people in polite ways, not confrontational ways, but just polite ways. His major sort of signature move basically was to leave the room and on the way out ask, oh, just one more thing. And that one more thing would be a question that called back to something that the person had said earlier that didn't fit with their latest story, and ask them, how does those two fit together? Help me understand that. His was obviously trying to extract a confession because, he's a cop in a detective show and it wouldn't be much good without that. We're not trying to catch our people out with this. We're not trying to make a fool of them or to sort of show, oh, you said this, but it doesn't match up with what you said before, so you must be lying or anything like that. But what we are aiming for is some type of aha moment where they catch themselves and notice that, hang on, this stuff that I'm saying doesn't make sense. I might need to consider looking at this in a bit of a different way. Maybe, when I say I don't need to change, that doesn't capture everything that I'm feeling at the moment. One of the things, and this is a little bit unrelated, but it's always struck me as kind of a little bit related to motivational interviewing, and it's around my attitude to washing dishes. If someone were to ask me, David, how do you feel about washing dishes? I would say I absolutely thoroughly hate it. Can't stand washing dishes. My least favorite job in the whole world. I'd rather put it off and not do it at all. And I will present that belief very firmly. But, like all of us, I produce dirty dishes and they have to get washed. And the strange thing is that when I actually pay attention to it, my experience of washing dishes is that I actually don't mind it. I'm washing dishes, everyone leaves you alone because you've got your hands in the water. The water's warm, it feels actually okay. Nothing needs as much scrubbing as you fear that it does. You can focus on one plate at a time and, slowly work your way through it. And there's almost, a relaxing quality to it. And that's remarkable because, my belief would be, I hate it, but my experience is actually, no, I don't mind it. And that's the sort of discrepancy that we're wanting to bring out, so that when we actually notice, oh, hang on, you tell me that you don't like, doing these things sober, but you also mentioned this other time when you did help me to understand that discrepancy. And that way we can help to guide the person and move them. And this is why it's a directive approach. It's not completely free form. It's client-centered in that it's on the stuff that they talk about, but we actually are directing them to think about and talk about these different discrepancies. And when we do that, if there is that ambivalence there, it's likely that they're going to engage in more of that change talk. So the reason why I bring up Colombo is that this webinar goes for an hour, and I've rushed through it a bit, so it's slightly less than that. But even if I had have done it slowly, it would have only been 60 minutes. There are 69 episodes of Colombo. You'll get a better demonstration of an motivational interviewing style and a motivational interviewing mindset out of 69 60-minute episodes of Columbo than you would in a 60-minute discussion of me just telling you stuff. So what I think is a really good thing to do occasionally is to, and I'll set this as homework, weirdly, that I have no way of checking up on, and you can do or not do, you know, however you like, but as a suggestion. Sometime in the next few days, take some time to go back and watch some Columbo. There's entire episodes of it on YouTube that you can just search for and find. As you're watching it, I'd like you to think about the people you know, the clients that you have, who are in one of those stages where motivational interviewing might be useful. So thinking through your caseload or who's on the ward or whatever at the moment. Who are the ones that might be in that in one of those stages where motivational interviewing is useful? And how would Columbo be talking with them to kind of move them along? If you were play acting as Columbo, how would you do it? In fact, do some play acting. You know, you told me this, you'd also hear you saying this other thing, help me put that together. These are things that you can practice, you know, in all of our normal daydreaming stuff, like when you're driving to work and stuck in traffic, or when you're in the shower, or wherever you do all of your practicing stuff. And then, you know, practice it a little bit with some of those clients. Go into the room, or before you go into the room, sort of put your, you know, your metaphorical crinkled raincoat on and go in there as sort of like, I'm going to be curious and polite, and also patient with this person to draw out those discrepancies and see, you know, what that produces as far as change talk. For some people, it might produce none, but you'll have lost nothing even if you try. For others, you might find, bloody hell, this really did kind of change up the dynamic and allowed them to kind of access their own motivation that was already existing there in their ambivalence. And like I say, it's not going to be useful for someone who's pre-contemplative, or not as useful, because they don't have much ambivalence there to reflect on. But for somebody who is in that ambivalent stage, which is probably the most of our clients, even the coerced ones, they want to get rid of something from their life. That's the thing that's pushing them to come along here. And just see how you go with it. The very last bit that I'll end with, which actually mightn't be too bad timing, because it gives about 10 minutes left if anyone has any questions or any comments as well, because, you know, they don't have to be questions of me. I don't have all of the answers, but if you've got any comments or anything that you disagree with too, there'll be time to discuss it. So the one more thing, you know, Columbo having walked out the door and then come back, one more thing. As you're doing this, so remember that change is hard. That's how you will actually find the patience to manage the frustration of dealing with people who are in this process where they're wrestling with their own ambivalence, that there's motivation there, but it's kind of, they haven't kind of been able to put it all together yet. Yeah, and we know that change is hard because we can see it in our own life. That's why I'm not at the gym. That's why you're kind of with whatever change that you've wanted to do at some point in your life but haven't actually made stick. That's why that happened. Change can take time. But also, if we have a good relationship with someone, change doesn't hinge on any one conversation. The other beautiful thing about motivational interviewing is if we're doing it right and we're avoiding argumentation, that it actually really strengthens our therapeutic relationship with people, because it's about listening. And what listening does is build a therapeutic relationship that's strong enough that there will be another conversation down the track. We don't need to panic about this one being the one where the person has to leave, having made a commitment to, oh yes, you've convinced me now, David, I'm going to go away and change this. But we've had conversations that are all pointing in that same direction that buy us the opportunity for more conversations, which get us progressively closer to it. Because if in each of those our clients are talking about change, they're engaging in change talk, then eventually they're going to actually start doing that change. So that's all I have for you today. I don't know how it's
Thank you very much, David.
the questions are going to be structured. But
No, that's look, I was thrilled to hear you. Well, firstly, I'm always a big fan of anything 80s, 70s, 80s, 90s television related. So I appreciate the references immensely, and I think it also is a reminder of there's a lot of when you look at medical shows, there's a lot of badgering and berating of patients into trying to get them to see the errors of their ways, and I think what you've talked about there sort of emphasizes the other way of looking at these things, that it's actually more about sort of listening and not trying to not take that approach that you might see in ER or scrubs or wherever else, where it's about getting the person to be a better person and whatever else, which, as I'm sure many people on there can entirely empathize with, is rarely successful. I'll continue the conversation and pepper you with some more questions in a moment, but please, people that are out there, please jump in and ask questions if you've got them. Please put them in the chat, put your hand up, put whatever else. You mentioned that you don't think it's necessarily the best approach in the pre-contemplative. Permission to challenge that a little, if I may.
Absolutely, yes.
And if you don't,
Chris, we've just lost your sound. You've cut out sound. Sorry, we can tell you're still talking, but you're back.
Can you hear me now?
Yes. Yeah.
Oh, okay.
Sorry. So we kind of lost you at around the point where you said permission to challenge. So you're gonna have to start back there.
It's probably the computer.
It sounded like you've been denied permission, but that wasn't the case.
It was me. Perhaps the computer was trying to tell me something. David, for patients, I think the key patient that I'm thinking of that's pre-contemplative, that I probably see the most in the pre-contemplative setting, is the prescription dependent patient, whether that's opioids, benzos, whatever. And I guess I still probably use a motivational interviewing technique, but have you got suggestions on what would be an alternative technique? And I guess is there still not some benefit to be gained out of doing some motivational interviewing, or at least utilizing the approach that you've talked about today?
I think there's definitely benefit to be had from it, and it can actually produce some movement. It can move people along from pre-contemplative to contemplative, but you're not likely to see the same huge amount of change. And sometimes it can be about planting those seeds and just and this is where it can be useful to incorporate it with some of that harm minimization stuff as well, so that they can it brings to their attention some of the harms that they might be experiencing, some of the risks that they're subjecting themselves to, and that helps them perhaps to incorporate that into their future decision making and their future ambivalence. So that's what I mean about planting the seeds. It's still worth doing, but and it can be useful, but you're probably not going to see much change straight away. The stuff that is going to be most effective is the stuff that they volunteer. So for some people, it might be things that wouldn't seem important to us, but for a 16-year-old, I got so drunk that I made a fool of myself and then wasn't invited to the next party, might be far more convincing than anything that we could come up with around the health effects.
I think that's that's kind of, I think that you've summed that up nicely. And I was going to say that often what I say with my patients, particularly the ones with opioids, is what's your pain out of 10? When if they haven't had their opioid, 10 out of 10. And what is it when you haven't had it? It's what is your pain normally? About an 8 out of 10. And if you don't have opioids, 10 out of 10. It's like, so you're getting a 2-point difference in your pain scores, even despite having, all this medication. And I think I like to think there's been a slight moment of realization at that point that really it's perhaps not making the difference that I thought it was. But anyway, following,
and it is, those scaling questions are a part of it. And I don't think we can underestimate how much planting those seeds can be helpful down the track.
Yeah.
That there's often the sort of stuff that they might come back 6 months down the track and go, I've been thinking about it, and they mention exactly the point that you raised, but it's a slower burn when you're further around that side of the stages of change.
And golly, it's not like clinicians like doctors to want instant gratification. Now, I had another question on here from one of our clinicians, Craig Rogers, said, thank you for your presentation. Is it okay to ask direct why questions, e.g. why do you use drugs? As he was once told in a motivational interviewing lecture, that you shouldn't be that direct. So, asking, why do you do this?
You can. I think it depends on your relationship. Some people respond to why questions, and sometimes, especially if it's someone that you know well and you have a good relationship with, you can ask really direct questions like, why the hell did you do that? And they will be able to answer it. But they can be a bit confusing for some people. And I think, especially early on, which is where probably, a lot of the motivational interviewing happens. And it can help to be more specific. If you try and frame the same question as a what question. What is it that you enjoy about drugs? What is it that's not so bad? You'll get the same answer, but often in a way that involves less kind of imposition on the brain power of the person that you're talking to. Because, if someone asks me, why do I leave my desk in a mess? I don't know. It's too big a question. But if someone says, what is it that gets in the way of me cleaning up my desk? I can actually have some specific answers to that. And so it's the what questions seem to just make it a bit easier for people. But having said that, if you've got someone who you have a good relationship with and that they answer why questions, then go for it, whatever works.
I think you've touched on something really nice there, David, in that you've said, what is it that stops you? You've shown an element of empathy. And so when you say to somebody, why do you use drugs? It sounds very judgmental. Like, why do you use drugs, you idiot? Why don't you clean your desk, you muppet? But if you say, well, what is it you like about drugs? And people will often, and then it gives you the opportunity to also then ask the other question, which is, well, what is it that you don't like about drugs? And people will, I don't think I've ever had somebody come back to me without being able to answer what is it they don't like, even when I think they're pre-contemplative. And I think also, I don't think I've ever had somebody, but I think the majority of people actually end up naming more things they don't like than they do, which is interesting as well. So you can sort of say, oh, okay, there seems to be more things you don't like than you do like. That's weird. Yeah. You don't have to, be that unsubtle about it, but you see what I'm getting at.
Yeah. And the more specific you can get them to talk about it, probably the better, because then it personalizes it for them. Often why questions, you get a lot of the, people tell me I shouldn't, and you get the responses that they think that they should give, especially with young people. It might be different with older people, but if it with the what questions, I'll talk about what it is specifically in their life that's working and what's not.
Fantastic. Well, look, I've waffled on a bit too here, so I'm afraid I've met there's no time for any other questions. So I'm sorry to everybody, anybody else that might have wanted to jump in with a question there. But if you can join me in thanking Davidson Quentin for a great talk on motivational interviewing. And I'll remind everybody that next week we have we've got quite an interesting presentation next week on Kamini. So we've got Dr. Philippe Naran, who'll be talking about novel opioids and their case series that they wrote and have recently had published in, I believe, Drug and Alcohol Review, on a case series of people who used Kamini, many of which probably, for those of you who haven't read the cases, probably perhaps you weren't even aware that they were using an opioid. I have to admit I have a slight self-investment in this, and that I've recently written an editorial about this case. There's been a few case series of these, so something that would be really interesting to look forward to. But for now, please join me in thanking David, and I'm sure we'll have you back again for a third round in sometime in 2023. And at that point, I expect you to have been hitting the gym and be bench pressing 500 kilos at that point. Okay.
I hope to not disappoint you. Thank you for having me along.
No problem.
That means I'll have to think of something else to. Yeah, thank you.
No, thank you, and see you all next time.